that city employees, that are people that are outside. If you're going to some sort of event or meeting or wherever it may be, I'm asking people to please, if you're in the presence of someone else outside of your home, please put on your mask. And quite frankly, if you're in your home, don't know where they have been, I'm going to ask that you put on your mask. I'm going to ask that you engage in social distancing and make sure that you're washing your hands. Sanitizer. Let's be very intentional for this month. And if we work together, I think this month or the next week or two, we ought to, hopefully we'll see positive results, and not only flattening, but hopefully the number will start to come down. And again, the goal for us, use ventilators, you name it, such that our healthcare delivery system is not overwhelmed. So that's our goal, regardless of somebody whether or not there is a shutdown, no shutdown. I am asking it to do what they know we need to do collectively in order to win this battle against COVID-19. Having said that,
Mayor, just wanted to follow, part of it is over.
Yes.
Have you looked at the numbers and thought about, I know you canceled everything city related for July, but there's still stuff in the books for August, you know, at the GRB and various other activities. Do you anticipate canceling all of those as well, or where are you looking at?
I know for city, most of those events will be canceled for the months of July as well as August. What the events that will take place that are city sponsored would be, for example, the mayor's back to school event, but that's being totally reimagined. Instead of it being hosted at the George R. Brown, for example, when we're bringing 25,000 people together, that will be a drive-by at the NRG, and that will be done in collaboration with the Houston Food Bank. We'll be passing out food, masks, as well as totally rearrange that. For most of the other events, like parades, you name it, those are being suspended.
Do you anticipate being able to rent out any
that are being planned in the month of August? I think the first one that may be of any sort of size, I think there are any major events planned in the month of August.
Before, but the challenges of contact tracing when the numbers are above 300, and because we're still hearing stories out in the community about how it's not working very well, I guess.
Well, there are two problem results back from testing within let's say 3-4 days. Because when we're using these big national labs, LabCorp and what's the other one? And Quest Labs, it's taken in some cases 2 weeks or more to get back the results, and that makes almost those tests useless. And so that's one problem. The others with the numbers, when the numbers are like over 800 or 700, like what I gave today, it's very difficult for the contact tracers to be able to follow through, to contact, isolate, identify, treat those individuals. And so the goal for me, what I've said, is that we need to get that number down from 800, for example, down to 300 or below, to make it possible for our contact tracers to be even more effective. We have about 230, 240 right now. The goal is to go up to 300. Quite frankly, we need even more of those. And so we're looking at various ways on how we can reach more people. But when the numbers are 800, and what did I give out? 884. It makes it on a daily. It just makes it very, very difficult for a contact tracing program to be effective.
Yeah, the mayor's exactly right. The volume is enormous. So a couple of things that people can do. So let's talk about what we can't get quite done. But what we can do is that if certainly if you went to get tested because you think you were a contact of somebody who you know to have been positive, whether it be a family member, co-worker, neighbor, if you think you've been exposed and that's why you went to get tested, you should just assume that you've been exposed and quarantine yourself until such time as you get the test results back. Certainly if you went because you got symptoms, isolate yourself. It's functionally the same thing as quarantine, but you isolate yourself at home and monitor your symptoms. And if you get sick enough, call your physician or go to one of the neighborhood clinics to get find out if you're sick enough to require hospitalization. So those are things that we can do. In addition, if you are symptomatic and you want to get tested, you can do your own contact tracing. Because really it's for we look to about 48 hours before your symptoms begin as to when you start, we believe that people start shedding virus. So you could actually do your own contact tracing. and think hard about who you may have exposed before your symptoms began, and advise them to quarantine and or go ahead and get themselves tested. One last thing is that we talked about this last week, is that when we're doing the case investigation, we'll get we send you an email. It's going to have that'll be Houston Health Department or Houston Health at Qualtrics. So look for the word Qualtrics. That's us. As we're calling people, we're sending emails, and we're sending texts.
Talk about this. We talked to the folks at Morales Funeral Home today, and just for their slice of life, they saw double the number of deaths this last month than the month and higher, just from what they're seeing on the ground. Where the lag is not any better, and that we might see a big jump at some point?
So yeah, you're actually touching on a couple of things. The reports that we give of people who have died related to COVID are the ones that we know, because we've got the death certificate, which includes the physician's statement that there was a COVID-related death. And the lag is very often, that has to be done within 10 days of the death. The lag is sometimes either a month or more behind, right, to get together to finish that. There is no, imagine families sometimes struggle with a lot of things that are going on when somebody dies, especially when it's an elder person. It tends to be the leader of a family. So there's a lot of stuff that goes on. So that's why we're sometimes behind. I feel confident that within Harris County that we are not missing any COVID-related deaths, because our medical examiner is what I describe as an academic medical examiner's office. So every death that occurs, whether it be at home or in the hospital, gets a death investigation to the degree to determine if the medical examiner wants to pursue it as a COVID-related death. So is it possible that we've missed some? Yeah, maybe, but I don't really think so. Because, like I said, this medical examiner is being very aggressive in the case investigation of each of their deaths to determine whether it's COVID-related.
6, Major League Baseball games start this week. Would you like to see Astros fans in the stands sometime this season despite COVID?
Astros fans are in the seats. I would love to be in the seats myself. But in order for that to happen, we are going to have to be intentionally focused on reducing the community spread today, like yesterday. So if you want to see people in the fans, if people want to see themselves in the fans safely, then they're going to have to put on these masks right now. And they're going to have to engage in the social distancing. All of the things that we know work against this virus are the things we're going to have to do right now in a very focused, intentional, collective way. So I want to see fans in the stands. I want to see our kids in school. I want to see businesses to remain open and to flourish again. But in order for that to happen, we're going to have to take the fuel and the energy away from this virus. And the only way we can do that is to put on these masks and do those things in the months of July as well as August. Well, I think there's a safe of a vaccine. They're just not a safe way. I mean, yeah, can you social distance people quite a bit? Yes, you can. Okay. But all I'm simply saying, in order for us to get to that point, there are some things we just need to do right now. There are no quick ways to do it. I think what's on the screen is important. I mean, you see Simone Biles, you see Carlos Correa, you see Slim Thug. That's me. Some people get me confused with Denzel Washington. But no, those are the things that we need to do and take this virus very serious. And quite frankly, I mean, going back to what Maya Shea had to ask about contact tracing, the best way to follow up and make contact tracing to be effective is to, okay? It makes it very difficult if you're in a party of 50, 60. So I want to see all of those things take place, but I want us to be intentionally focused today, July 21st, July 22nd, July 23rd, in putting on these masks and staying away.
A BYOB strip club in Southwest Side is operating in the open and is packed this weekend. It's BYOB, so it's not subject to TABC regulation. Is this a problem? And if so, is that an unlevel playing field for local bars?
Outside, for example, of the governor's order, and these BYOB clubs are bringing the BYOB coronavirus called COVID-19 right there with them. Look, there is no substitute for individual responsibility. We can talk all of this stuff all day long, But if people ignore the science, the medicine, the advice that's being given, and simply want to be irresponsible, that's unfortunate. That's unfortunate. But I do think it's important for people to be very respectful of others, as well as to be respectful of themselves. And so I do know that there are people that are gathering. I don't know if we have the occupancy limits on that. Let me yield to Chief.
We show up, we do ensure that we are talking to business owner through the process to ensure that they come into compliance with the governor's executive order. But in the end, it is the responsibility of the business owners to provide a safe environment for their patrons. And it comes down to personal responsibility for the individuals frequenting these locations. We are with the TABC, and we're referring those businesses that do not or refuse to come into compliance with the governor's order. We refer those administratively to the TABC. Even not only the red tag ones, but now the blue tag ones are being referred to TABC for whatever administrative action they're taking. And that was as a request from the TABC. Okay, so that's an additional tool, I guess. But in the end, as the mayor mentioned, it comes down to personal responsibility. Wearing your mask, physical distancing, and proper hygiene is going to ensure that we're limiting the spread of this virus.
Since you're telling 11, how do you respond to complaints that there is a delay in notifying firefighters, EMTs, and paramedics that they had contact with COVID-19 positive patient, specifically after hospitals notify the city? It is allegedly taking 7 days or more to notify those employees, potentially putting them, their coworkers, in a public arrest.
But I'm not going to speak to a hypothetical. What I can tell you is that we, at the Infection Control Office with the fire department, is we depend on the information that coming from the health department, from the hospitals, from other agencies. And the turnaround in notifying those personnel, especially the ones that need to be quarantined,